Thank you for coming again today. We're here to discuss the Zero Hazard and our initial PowerPoint presentation on the effectiveness and the use of the product. My name is Ron O'Ravitz. I have a little more than 30 years in the food industry. Got a degree in food science from Penn State, and I've been working for the last many years as a consultant throughout the United States in the food industry primarily, working on food safety programs and trying to kill bacteria and viruses that are in the facilities. Strong background, once again, for 30 plus years in sanitation and food safety. A lot of the big Fortune 50 companies I've worked for, just to name a few. I have worked with Hershey, a lot of projects. Northeast Foods down Baltimore makes all the products for McDonald's and Burger King, Wendy's, what have you. And a lot of other companies in the top areas. And Coca-Cola was one I just finished a consulting project for, working on the food safety products. So I've got a lot of good background, a lot of work with those guys, and they're all fighting through the same issues. And when you have a big company like that, the big thing is protection. They're going to ask, are you ready to protect them? And the big thing is, you look at their brands, you look at their label, it's worth billions of dollars. And we've got to be ready to protect that brand. And that's what the whole thing is. My whole career has been protecting their brands. Go in there, explain these programs, explain the chemicals we're using, and be effective in protecting their customers and protecting their brand. Big thing today we're going to talk about is, we talk about Zero Hazard, and we're talking about COVID-19. You've heard about COVID-19 enough. COVID-19, is a coronavirus disease from 2019. Big news, what is COVID? COVID is a new strain of coronavirus that was not previously identified in humans. COVID-19 is the cause of the outbreak of respiratory illness first affected, as we know, in Wuhan, China. The virus is known professionally as the Severe Acute Respiratory Syndrome Coronavirus, abbreviated as SARS-CoV-2. COVID-19, as we saw in the news today and just this week you watch, is now a pandemic affecting the world. It's worse today, I know in Pennsylvania, was when it first came out. Things are progressing rapidly at this rate. Two simple things to remember is sanitizing, disinfecting. Sanitizing is the act of decreasing the amount of virus, bacteria to minimize the opportunity for infection. Whereas we're talking about disinfecting is the act of removing all evidence of the virus or bacteria. So there's two different levels. In food facilities, you're looking at sanitizing, so there's enough bacteria removed to doesn't start any more dangers or shelf life for products. We're looking at disinfecting. Once again, that's removing all the bacteria and viruses to be a safe area. Interesting things to remember is how is COVID-19 spread? It's an active viral growth occurring in the upper respiratory tract and lungs. Peak viral shedding seems to occur at the time of onset, which means as soon as you get the disease. The important thing about remember is the absence of a cough, which is the key mechanism for viral expulsion, may limit transmission. So if we have COVID-19, you're not coughing, it does minimize the opportunity to spread to other people. But that said, three important human functions is coughing, talking, sneezing are all simple ways COVID-19 is spread amongst humans. Those things we do all day long without even knowing. You're coughing, you're just talking, sneezing, you're not even thinking about it, and you're doing it. All those three things can spread the COVID. Two important things to remember, there's high-risk groups and low-risk groups as far as COVID is concerned. The low-risk groups are things like we're doing today on a Zoom call. You're looking at virtual classes. We're not around people. We're not touching people. Proper PPE, personal protective equipment. You're looking at masks, gloves, what have you. And contact surfaces, sanitize, with a zero hazard. That'll protect you, somewhat through some of the bacteria and the health issues that we're dealing with. The high-risk category is when you have large groups, a group of over 25 people or more, now as the CDC is saying, no separations between people. We talked earlier where you have, a CVS, a Walgreens, a Walmart, whatever, with the plastic screens in front of you. So then at the checkout, they're not expelling and breathing on you. Lack of PPE. Again, I said I was in the grocery store today and people didn't have their masks on. It's a Pennsylvania law now. You have to have your mask on. And people just weren't doing it. So there's a risk for spreading because of that. And then the other one is insufficient cleaning, which we can improve by using Zero Hazard. Contributors to the spread of the COVID, along with many other diseases, is mass gatherings, which we're not supposed to be in groups more than 25, which we're not. Aging population, people with compromised immune systems. Simple compromised immune system, an illness, diabetes. A lot of people have diabetes. That alone is a higher risk factor for catching COVID. Lack of awareness. Some of the things I mentioned earlier today, you're supposed to wear PPE, you're supposed to sanitize your hands, you're supposed to wash after you use the restroom, what have you. Those things are to be done. They don't cost any money, and the lack of awareness, we just don't do them. We don't follow through. Big one I've talked about a couple times is improper personal protective equipment, masks and physical barriers. They're there, we just don't follow through with the program. The interesting thing in the red on this slide is the average number of people infected by one person in a susceptible population, high risk, is estimated between 2 and 4. So you have a group of 25 people, and you're risking getting 25 to 50% of those people contaminated with 2 people having COVID. The risk is there. We've got to be prepared to protect ourselves. Personal measures, again, simple things that we know that are common. Hand cleanliness, sanitizing your hands. Respiratory hygiene, wearing your mask, and surface sanitizing, with a zero hazard are all important times to protect yourself and others. Simple things, remember, masks, hand sanitizing, cleaning. Simple things again, masks, hand sanitizing, cleaning. When it's possible too, you should maintain 6 feet between yourself and others. Again, we talk about breathing, coughing, sneezing, spreading the COVID. Well, if you're within 6 feet, you're increasing your risk of getting it, from people being around you. Some effects, and the interesting thing to remember is some infected people may not be exhibiting symptoms when they have COVID, which is called asymptomatic. Somebody could have it and just don't have the symptoms showing it, or they're fighting it in their body. And so you can still be contagious by not having symptoms. So that's why it's important the 6 feet, the mask, what have you, to protect yourself, because there's still the opportunity to get contaminated from that. So it's physical distance is important for everyone and everything we do right nowadays. We've got to maintain that to get rid of the illness. Some simple control measures. Talk about hand sanitizers. We all use them in our house. You see them in all the stores, what have you. Hand sanitizers, the CDC and EPA are saying now, anything with 60% or more of alcohol is effective, for sanitizing. Masks are important so we don't spread the disease with breathing, sneezing, coughing. Social distancing again. You got to be 6 feet away when possible. Shouldn't be large groups. Then it's cleaners approved by the FDA and EPA. Like we're talking zero hazard, electrolyzed water. We're approved by the FDA now, and we're working on getting approval by the EPA. And once we get that, we'll have a higher claim to be able to make, which will be very effective for us. So increase our function and our ability to market this product. Big thing is when you talk about these types of control measures, again, I know I've been through a lot of physical audits with FDA and EPA and the facilities that I ran. The big thing is they always say, okay, we did the training today. Big whoop-de-doo. Come next month, we all forget what we talked about. So the big important thing is reinforcement with literature. And at some time in this program, we put things together, we're going to be providing context for the literature from the CDC, EPA, what have you, where to get it, from charts to maps to what have you we talked about, with signage, video, social media, floor directions, physical barriers. We're going to provide opportunities to show you guys where you can get those, because it's going to be important to provide to your customers. They're going to ask for those, and we're going to show them where they're at. And they're going to be CDC approved literature that you can post in places, once again, so you do not forget what we need to do. And that's what's happening now in the country, is we all know what we should be doing, but we're lazy and we forget to do it. By having a poster in front of your face that says wash your hands, makes it a little more common to do it more frequently. The use of zero hazard, the hydrochloric acid, the important things, we're always talking about safety. Once again, zero hazard. You look at it, it's made by human white blood cells. It's made in our own bodies for protection and healing. So our own bodies create it. It's already in us, so it can't be bad. We make it every day. Important thing to know, it's effective at the same pH as water. Those of you who don't know what a pH is, that's a chemical standard where it's a range of 0 to 14. 0 is acidic, like a lemon and a lime and vinegar. High end of 14 is more like a caustic, like a Clorox, what have you. Water is 7, it means it's neutral. So when it's water, it's not going to burn the skin. It's that simple. Same pH as water. Important thing with OSHA, Occupational Health and Safety Organization, our government has given zero hazard 0 safety ratings. 0. So there's no safety ratings at all concerns with this product. 0 warnings, again, 0 hazards. Important thing to remember, it's been used successfully since 1870 over in Europe. They're using it in World War I and II for soldiers out in the fields for a quick sanitizing of their bodies when they got hurt. It replaces the use of harmful toxic chemicals. As I mentioned, 30 years in the food industry, what have you, there's a lot of dangerous chemicals out there. I used to sell them, and I'm embarrassed to do some of the stuff because they did cause harm. I've seen it happen. This product, zero hazard, again, doesn't cause any harm. As we said, it provides no risk to humans or animals or any of your equipment. Important things to remember. A lot of the other stuff that's used out there does damage equipment, and it can harm human and animals. It also attacks viruses. We're talking about attacking COVID, MRSA, and SARS are the big ones you hear now. They're all coronaviruses. And once again, once we get the EPA standards, we'll be able to label that it's attacking the COVID. Also, the interesting thing with sanitizing, this zero hazards, it does attack bacteria. Y'all hear in the news, Salmonella, E. coli, Listeria, a lot of other ones. These are common in food industries, for food spoilage, but they can kill you. And with zero hazard, as far as sanitizing, it does minimize the risk by using this product. Interesting to remember, years ago, there was something called the MSDS sheets, Material Safety Data Sheets. About 10 years ago, the government changed it. It was the first change in like 30 years. They changed it to something called SDS sheets. It stands for Safety Data Sheets. It's regarding hazards identification. Interesting thing to mention is the following values that we'll talk about are guidelines prepared by the National Fire Protection Association, the NFPA, and the American Coatings Association, which is the HMIS systems. If you look at them in the chart below, the hazard material identification system, they have ratings of 4 different things: health, flammability, physical, and reactivity. Look at the zero hazard product, again, hence zero, they're all zero. Means there's no risk. And there's all the ratings. If you look at from the NFPA, they rank the zero as a minimal hazard, meaning pretty much that there is none. You will not see another chemical out there that's as effective as this that has a zero rating. None of them have them. I've used them, I've seen them all. They all have some rating, some danger rating. Hazard information disclosures, you look at zero hazard, does not, once again, fall under hazard categories. The 2 government agencies are SARA and OSHA, and they say this product is not a hazardous chemical as defined by OSHA standards. Once again, zero hazard. We do put on the product label hazard information: avoid contact with the eyes and skin, wash hands after handling, and keep out of reach of children. Simple, basic, common things. Those are simple hazard things for just any kind of drinking soda, eating, what have you, things that you should just be doing. Common sense things, just to keep clean. The last slide here, it shows, this is our label that we're looking at. Some neat things we have. We talk about it's highly effective, it's eco-friendly, zero hazard. On the front label, it talks about what kind of sizes it comes in. We're looking at gallon, 5-gallon, 30-gallon, 55-gallon drums, and 270-gallon totes. So whatever your customer size is, the availability for them to buy and afford it is there. You look at the drug facts, you look at some of the things. The active ingredient is sodium hypochlorite. It talks about the usage, washing, peeling fruit, indirect food additives. Once again, indirect, the things it's talking about just once again explains how safe it is to use, if it can be used indirectly for food, what have you. And then we'll talk about, we'll have a production date and the manufacturer, all this should be on the label. As we talked about briefly before, once we get the EPA standard, we'll be able to put the EPA on the front label, our EPA registration number, which will make it that more highly effective and give us more support in the industry on how it can be used. One last thing to finish with, I've talked about earlier today, but you look like Lysol wipes is big when everybody uses the spray and wipe efforts. So everybody uses the Lysol wipe and wipes down their counters. And I've seen it happen in a lot of food plants. It depends what kind of pressure you put on with your hands. When you're wiping something, when I was talking earlier, when you try to wax your car, right? You step back from the car and you look, oh, I missed that spot, I missed that spot, I missed that spot. Because your pressure in your hands is different than your fingers. So when you're doing spray and wipe measures to get rid of bacteria, COVID, what have you, you're missing areas. By using, and they always fall short, the significant areas are missed. By using a sprayer, a CD-approved sanitizer, like we're talking about with zero hazards, you got large areas you can cover very quickly, difficult to reach places, and high traffic areas that require frequent treatment. You don't have to be hand wiping it down. You can spray with the sprayer and cover everything very quickly. Tests have demonstrated that it's up to 10 times better coverage using a sprayer than hand wiping. Again, because you're catching all the areas, you're covering areas that you didn't see. Inside equipment, on top of equipment, under tables, under doors, what have you, that you didn't see before. When you're spraying, the droplets when using the zero hazard, the things with the droplets, because the way they're changed and sprayed in the mist and the sprayers, is that once again it contacts all the surfaces again. So when it gets away from the spray and wipe efforts where you're missing areas, you're going to cover more and more areas and less risk of missing things. Once again, because the mist is so fine, again, you're going to be getting inside of equipment, outside of equipment, in spaces that you couldn't reach before, that you never saw before. And that's it. I mean, so pretty simple, pretty basic. If this product works, it works well, it's safe to use. The big thing, zero hazard, this product is safe to use. I've seen it used effectively throughout the industry. People do like it. And once again, it just gives you the comfort level where people have maybe not be trained, some of your customers, and using harsh chemicals. It's easy to use. and no harm will come from them from the use of it.